ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. ಕನ್ನಡ ಇಂಗ್ಲಿಷ್ ದ್ವಿಭಾಷಾ ಟೋಸ್ಟ್ಮಾಸ್ಟರ್ ಸಂಘದ 107ನೇ ಸಭೆಗೆ ನಿಮ್ಮೆಲ್ಲರಿಗೂ ಆತ್ಮೀಯ ಸ್ವಾಗತ. I heartily welcome all of you to the 107th meeting of our KEBT club. I just want to give an overview of today's session. Our club being community club, we have members from diverse professional background. So we recently came up with an idea to do a panel discussion dedicated to each field. Today's doctor's panel is the first of its kind, and I am really excited on this session. So before moving on to the session, I want to give some points. Please put yourself on mute if you are not talking, unmute when you are talking. And I request you to turn on your camera if possible. Having said that, let's move on to our session. Today's session is hosted by Toastmaster Veera Shantiram. He is a wonderful person, a distinguished Toastmaster, serving as Division D Director. By profession, he is analog engineer at Texas Instruments. He loves food, music, books, and most importantly, he loves languages. So we have the right person to host our bilingual Kannada-English session today. Thanks for taking the role, Veera. Over to you.
ಧನ್ಯವಾದಗಳು ಮಧುರ ಅವರೇ. Thank you so much. ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. A very good evening to everyone. It is wonderful to see a lot of bright faces joining us. I know we do have a lot of members of our KEBT, Kannada English Bilingual Toastmasters Club, among us, and it is wonderful to also see members from other clubs across the country and across Bangalore who have joined us. So it gives me immense pleasure once again to welcome you all to the one-of-a-kind panel discussion from our very own Kannada English Bilingual Toastmasters Club. Toastmaster Madhura, I might require your help to mute anyone who might be mistakenly unmuting themselves. Yes. With that being said, today's session, we call it Ask the Doctors. So we have three wonderful human beings, three amazing doctors among us who are right there within our Toastmasters community. That makes it extremely special. So I would like to I wanted to have the privilege of introducing the three wonderful human beings, but yes, nothing like it when you hear from their own experience about what they are doing and why they are interested in what they are doing and what brings them today to our panel discussion. So I would like to start it off with our President of Kannada English Bilingual Toastmasters Club, Dr. AVS Prasad. Over to you, Dr. AVS Prasad.
Yeah.
Our audience will be interested in understanding more about your background as a doctor. Please go ahead. Yes.
Thank you, Veera. I'm Dr. Prasad. I am a homeopathic doctor. I studied in Mumbai and moved to Hyderabad looking for a quieter place. Place has become as busy, not as busy, but getting busier by the day. And I worked with Dr. Rajan Shankaran, who's a well-known, world-renowned homeopathic doctor. Then I worked in the homeopathic hospital. Subsequently, I tried to go to Pondicherry and settle. I worked in Auroville as a consultant and then moved to Hyderabad. I have created some software in homeopathy, etc., which is used across the world. So just that's about me. I would now like to, back to you. You can introduce the next person.
Thank you so much, Dr. Prasad. It is once again our privilege to have you here. And this brainchild of yours is going to be an amazing discussion today for sure. Next up, we have two esteemed guests who are no strangers to the Toastmasters community, who are no strangers to our Kannada English Bilingual Toastmasters Club. With immense pleasure, I would like to welcome Dr. Achrekar onto the stage. Over to you, sir.
Thank you, Veera. I am Dr. Achrekar. I am by profession urologist. Means basically we are surgeons. After completion of our general surgery training, that is master's degree, then we do a super specialization specifically in the field of urology, which comprises those diseases which affect the kidney, bladder, genital system in both men and genital system, where they can be treated only by surgery. So do not confuse urologist with the nephrologist. Nephrologists are the one who are basically physicians. And most of the time they treat the problems connected with only kidney. not necessarily the bladder, etc. But urologists, they are basically general surgeons, a surgical background, and they take care of the kidney problems, the kidney stones, the urinary problems. Then in the male, the genital problems. In the female, again, the urinary problems. All these things, specifically which require surgical intervention, are going to be dealt by the urologist. So I have got rich experience of, I have been a urologist for the last 40 years.
Wonderful. Thank you so much. Thank you so much, Dr. Toastmaster Achrekar. And as I was mentioning, I don't think I can insist this enough and emphasize this enough, that it is our privilege to have three wonderful people among us here. So thank you so much once again for coming over here. And next up, I would like to move again to one another Toastmaster and a member of KLS IMEA Toastmasters Club, Dr. Phadnis, whom we have among us. Over to you, sir, for having a few words shared from your experience.
Yeah, thank you very much. Good evening, everybody in this KEBT Toastmasters Club. First of all, I would like to appreciate Veera when you called us amazing and fantastic personality even before you heard about me. You are quite generous while appreciating our presence over here. I'm a physician by profession. But before I start talking about my profession, let me introduce myself as a toddler of a Toastmaster, because it is only my 5th year in the Toastmasters Club. 5th year in the Toastmasters Club. I am also happened to be a Rotarian since 1990. I have been enjoying my Rotary Association, and that is where I came to know Dr. Achrekar for the first time. I came to know about Toastmasters Club thanks to Dr. Achrekar, and I had invited him to address my club regarding the Toastmasters Club. And after I laid down my office as the president, I joined Toastmaster because somewhere I had to find out a networking option. And I have been learning a lot. This is only 5th year of my Toastmastership. That's why I call myself a toddler. I'm a physician. I studied in BZ Medical, Pune. 1982, I joined at Jain Medical College. So last 40 years, I've been practicing physician. I was a teacher in medical college for 38 years. And thereafter, I have given up. But I've got a habit of keeping on chatting up. Networking and socializing has been my weak point. That is how I came to know you also and Dr. Prasad also. I look forward to have more interaction with you, constructive as well as informative. Over to you.
Thank you. Thank you so much once again, Dr. Phadnis, for coming over here and gracing us with your presence. And that brings us to the end of the introductions of these amazing personalities that we have among us. So you all must be wondering what makes this or what drives this particular panel discussion. We all have heard of this one particular proverb right from our school days. Health is wealth. Arogya ve bhagya. So essentially, whatever you do, wherever you go, in any part of the country, any part of the world, and whatever the job that you do, at the end of the day, all we want is a peaceful sleep in our home. And the biggest thing that affects rather the sleep or the peace that we have mentally or physically is our health. So health comes first as the highest priority at any point of time. But nowadays, with the increase and the change in lifestyle, with the advent of technology, we have been noticing that there are points where we are not at all paying attention to our health. Sometimes keeping ourselves super busy with work, I tend to do that. We have a lot of things on our plate, but health kind of takes the backseat, whereas it is not supposed to be the case. And today's discussion is going to be all about it. Our three doctors are going to be here to answer all of your queries regarding any of the doubts you might have in your mind, anything related to health, and any advice that you would want to take. And that is where we also had one fun discussion before the meeting even started. I would definitely want to circle back to it when we start off the panel discussion. But before we start taking questions from the audience, I just wanted to ask a couple of questions with our doctors here. You know, there is this one famous saying which we have all heard: an apple a day keeps the doctor away. So what are your thoughts on that, sir? I know it ultimately comes down to the food that we eat, but what do you think? I have always wanted to ask this particular question to a doctor and hear from them what they say. Dr. Achrekar, would you want to comment on it?
Yeah, obviously, my wife doesn't eat apple at all, but she's scared I'll be going away from her. See, it is just a saying to highlight the importance of eating fruits every day as a part of our in our food items, because many times we do not eat fruits. They are easily digestible, they give a lot of nutritional values. So how to say, Baba, you eat fruits every day? So they cannot go on naming every fruit. Apple is more no, it looks very attractive with the pink color, and the pink also represents the health also. Therefore they say if you go on eating apple, not necessarily you should only eat apple, but you should also take care of the other part of your nutrition. See, it's all they say, your health depends on what you eat ultimately. So that's why this particular proverb, or whatever you can call it, it emphatically brings home the point how you must be cautious while choosing your nutrition as a part of your health.
Absolutely. Thank you, sir. Thank you for that comment on it. And I loved how you had that fun twist of starting off the answer with your wife not eating apples. Thank you. So now I would just want to give a heads up to our audience members here. So you can raise your hand so that I can check who is willing to ask a question, and I will help in moderating one after the other. You can unmute yourself, or if you are in a place where you can't unmute or come on the camera, please feel free to drop the message in the chat window. Our doctors will take turns in answering the questions, or anyone would feel to add on to the points anybody has already added. All right. And also, again, a heads up, our doctors will be clarifying it. But I wanted to also mention that this is not going to be a consultation session, of course, where there will not be any prescriptions or anything. But any questions that you have in your mind, anything which you have always wanted to check with a doctor, you can feel free to. Yes. Yeah, I think I would like to now open the floor for any questions from the audience who have joined us today. So please feel free to raise your hand. I will make a note of it and we can go ahead with the questions. Okay, yes, I think I see Rajeshwari ma'am. I am seeing Rajeshwari ma'am's profile photo, but I read VJ.
Yes.
Yes, ma'am.
Vija.
Please go ahead.
Yeah. Thank you. This question, can I talk in Kannada? Will they
Yeah,
understand?
you can go ahead.
Yes, ma'am, absolutely. Yeah.
Okay. ಇದು ಒಬ್ರಿಗೆ ಅಂತ ಕೇಳ್ತಾ ಇಲ್ಲ, 3 ಡಾಕ್ಟರ್ಸ್ಗೂ ಕೇಳ್ತಾ ಇದೀನಿ. ಯಾರಾನು ಒಬ್ರು ನನಗೆ ಆನ್ಸರ್ ಮಾಡ್ಬೋದು. ಈಗ ಸಣ್ಣ ಆಗ್ಬೇಕು ಅಂತ ನಾನು ಹೊರಟಿದೀನಿ. ಏನ್ ಡಯಟ್ ಮಾಡೋದು? ಇದು ಕಲೋರಿ ಜಾಸ್ತಿ, ಅದು ಕಲೋರಿ ಜಾಸ್ತಿ, ಇದು ತಿನ್ಬಾರ್ದು, ಅದು ತಿನ್ಬಾರ್ದು. ಇದೆಲ್ಲ ನಾವು ಹೆಂಗೆ ವೇ ಮಾಡಕ್ಕಾಗುತ್ತೆ? ಈಗ 2 ಇಡ್ಲಿ ತಿಂತೀನಿ ಅಂತ ಇಟ್ಕೊಳ್ಳಿ, ಅದರಲ್ಲಿ ಕಾರ್ಬೋಹೈಡ್ರೇಟ್ ಎಷ್ಟಿದೆ, ಇದು ಕೊಬ್ಬು ಎಷ್ಟಿದೆ, ಇದು ಎಷ್ಟಿದೆ, ಅದು ಎಷ್ಟಿದೆ ಅಂತ ಸುಮಾರು ವಿಡಿಯೋಗಳಿದೆ ಯೂಟ್ಯೂಬ್ ಅಲ್ಲಿ. ಯಾವುದನ್ನ ನಾನು ಫಾಲೋ ಮಾಡೋದು? ತುಂಬಾ ಡಯಟ್ ಮಾಡಿದ್ರೆ ನನಗೆ ಎಕ್ಸಸೈಸ್ ಮಾಡ್ತಾ ಇದ್ದೀನಿ, ತಲೆ ಸುತ್ತು ಬರ್ತಾ ಇದೆ. ಹೇಗೆ ಇದನ್ನ ನಾನು ಕರೆಕ್ಟ್ ಆಗಿ ಡಯಟ್ ಮಾಡೋದು ಅಂತ ನನಗೆ ಅರ್ಥ ಆಗ್ತಾ ಇಲ್ಲ. ಯಾರಾನು ಒಬ್ರು ನನಗೆ ಆನ್ಸರ್ ಹೇಳಿದ್ರೆ ಐ ವಿಲ್ ಬಿ ವೆರಿ ಹ್ಯಾಪಿ.
Definitely, ma'am. Thank you. Thank you so much, ma'am. I just wanted to take a quick moment to translate it for the non-Kannada speakers here. So, Rajeshwari ma'am is interested in weight loss, and her question is very simple.
I can only translate, Veera. I will only.
Okay. Yes, please.
Yes. My question is for all the viewers, I think. Now I want to reduce my weight. I have started with exercising, everything, and follow a very strict diet. No sweets, less oil. I won't say no oil, zero oil. No. I use oil, maybe 5 to 6 spoons every day. No ghee, and 2 cups of coffee. And nowadays, intermittent fasting has become world famous.
Correct.
Whoever I ask.
Sorry, ma'am, you have gone on mute. We are unable to hear you.
This has become a trend or what, I don't know. But it really helps. Even I follow that. After 7, I don't eat. Morning 7. After 7, I start. Like that I do. Let it be one side. Now coming to this dieting. Morning 2 idlis with sambar I eat. Then I'll be worried. Will I put on? What will happen? Have I eaten correct food? Is carbohydrate more in this? Is protein there? So many questions run around in my mind. When I take a YouTube video, they say you should eat one dosa, that. Afternoon, one chapati, this. Night, don't eat only fruits. But if I follow this diet, I am becoming weak. I am unable to exercise. I want to exercise also every day. So what is the solution for this? Can any one of the doctor prescribe any particular diet to be followed, and it should be suited to my health also? That is also very important. But I am healthy, sugar free, BP free. So
Wow.
over to Veera.
Yeah, thank you, ma'am. I think once again, thank you so much for translating the question for non-Kannada speakers here. And you being sugar-free and BP-free, that is goals. So definitely goals for all of us. I would because we do have Dr. Prasad, who is practicing homeopathy, and we also have Dr. Phadnis, who's a general physician. I would like to hear both of their opinions and perspectives on this with respect to the diet and food. Probably I'll start with Dr. Phadnis on this. Over to you, sir.
Unmute.
Yes, you're on mute.
Yes.
Dr. Phadnis, can you hear us?
I am assuming there is a network glitch.
It's paused. His audio is paused. His video is paused.
Yeah,
Dr.
probably.
Phadnis,
Okay.
can you hear us?
No, I think now
Yeah.
moment is in.
Yes.
Okay.
You asked $1 million question, madam. To tell you frankly, there is no precise answer which gives solution to all the problems for everybody. What is naturally available, what is locally available, is going to offer a solution to most of us. Fast food, baked food, preserved food, tinned food, altered food, or chemically treated food should be avoided. Give more importance to raw food. Fresh fruits and salad are best suited. It is often said that when you start your meals, have a bulk of it consisting of salad or vegetables or fruits. If you are eating fruit, it's best eaten before your meals. At least half an hour before you take your major meal, have fruit so that you can derive maximum benefit out of it. Protein, carbohydrate, and fats, somebody has rightly said, minimize the carbohydrates and fat, increase the protein content. It is very easier said than done. It is very difficult to follow the diet in day-to-day life. It has become a fashion to give a diet chart to all the patients. How often do you think you will refer to the chart every day while deciding what to eat and what not to eat? It is not an easy solution at all. In general, it is said that a judicious combination of dal and rice, where you eat a khichdi, whether you eat idli, both are very good for adequate protein supplement as well as controlling the weight. But it is not only the amount of food that you eat that is more important, but also the degree of physical activity that you indulge. The kind of lifestyle that we are living right now, we want more and more luxuries to do less and less work and achieve more and more targets. We are moving away from the olden lifestyle that we have been following. We are just ogling at the Western lifestyle, and that is what the price we are paying for. Simple thing, the physical activities that we are performing today are minimum. For example, some of you are working on IT industries or who are working on the time zone belonging to the Western countries. You are indoor in air-conditioned atmosphere. You do not get exposure to natural sunlight also. Now, for your information, let me tell you, 90% of us here present in the audience right now will have deficiency of vitamin D. If you subject yourself for testing, most of us will have deficiency of vitamin D. Do you know why? Because we do not have exposure naturally available for us. We work at odd hours commensurate with the working hours abroad. So the lifestyle has to be changed. Plus, of course, the stress factor that even excessive stress is supposed to add to the weight gain. If you achieve some relaxation by whatever means that you are fond of or what you are capable of, will help you to reduce the weight. Having adequate sleep also helps you to reduce the weight. Suppose you work overnight, 18 hours a day and 20 hours a day, but you're deprived of sleep, right? Brings about the hormonal changes in our body, makes you more obese. So the entire lifestyle has to be changed. The emphasis need not be only on diet. Need not be only on diet. It has to be a, global management, or not concentrating only on diet at all. More of fruits and vegetables, less of carbohydrate, and sufficient amount of protein. That should be the balance.
Yep. Yes, sir. Thank you. Thank you so much. I think you had a very detailed answer to the question that Rajeshwari ma'am had asked.
Thank you.
As I was, yeah, thank you, ma'am. And as I was saying, I also wanted to hear from Dr. Prasad too,
Sure.
because with a different background. Please feel free to add your comments, sir.
So first of all, Rajeshwari ma'am, I think you're doing already a good job in terms of not eating junk foods, being conscious of what you're eating, exercising. The only thing that I would add to what Dr. Phadnis said is, rather than keeping losing weight as your target, try to be fit, try to work towards fitness. Also, just losing weight for some reason, you should check if your BMI is good. If you're in the normal range, there is a simple calculation you can do for your height, whether your weight is appropriate. If it is appropriate, don't try to lose. If you're somewhere in the average, then that is fine. Focus on becoming stronger. The second thing is, it's not that all fats are bad. Actually, fats are essential. You can have carbohydrates, you can reduce and have less fats. And as Dr. Phadnis said, more protein. Don't worry about morning whether I'm eating idli or whatever. You just see that overall in a day, you get your different, a balanced diet with good amount of roughage and protein and this thing. That's all. And a simple suggestion for everybody is after eating, walk for some 10 minutes. It helps a lot. Don't lie down, don't sleep. Okay. Though I give this advice, but I tend to take a nap. Back to you, Vedant.
Yeah.
Thank you. Thank you, sir. Thank you for adding on.
Can I come
Yes,
in?
yes.
You
Sure,
started off with that proverb, apple a day keeps the
Yeah.
doctor away. How many of you really believe that proverb is true?
At least in the sense, if we are eating
Achrekar
more.
himself honestly was telling us that his wife does not eat an apple. But how many of you believe apple a day keeps the doctor away?
You get a typhoid or you get malaria, I don't think an apple or dengue or something like that
is going to cure, yeah.
Yeah. But let's move on with the questions with little
Yes,
bit
yes.
briefer answers will be like quick, and otherwise we'll have only 3-4 questions. We're already at 7:30.
Yeah. Yes, right. So considering the time that we have, only half an hour more left, let's quickly move on to the next question. I believe distinguished Toastmaster Bosco had raised his hand. Bosco, sorry, yes. I think you're on mute.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ.
ನಮಸ್ಕಾರ.
ನನ್ನ ಮನಸ್ಸಲ್ಲಿ 2 ಪ್ರಶ್ನೆ ಇದೆ. ಒಂದು ಡಾಕ್ಟರ್ ಪ್ರಸಾದ್ ರವರಿಗೆ, ಇನ್ನೊಂದು ಡಾಕ್ಟರ್ ಕಮಲಾಕರ್ ಅವರಿಗೆ. ಡಾಕ್ಟರ್ ಪ್ರಸಾದ್ ಅವರೇ, I will switch to English now.
Yeah, go ahead.
I was very confident about homeopathic treatment in the last 4 or 5 years. For all my ailments, I went and I did get the required cure that I was looking for. In the mid of December, I got into a bad cough. I went for the medicines, but somehow it did not work. It worsened and kept on increasing to such an extent I got congestion in my chest, with later on ended up with a wheezing. So I had no choice because my family wouldn't allow me to go for a homeopathic treatment. They said very slow. So I went for allopathy. In fact, it's only last week that I feel, from last week, I'm feeling a little comfortable. Is it true that homeopathy works slowly? If so, if the patient gets into a situation which we would call seriously ill, how would you handle that?
All right. So the thing is simple. In chronic conditions, the results do take time. In many acute conditions, we are able to give very quick results. But it is not that in every case we are able to cure the patient. Just as you were talking about your cough and wheezing, there are patients we get who have been on other treatments and they come to us for asthma. This is a very common thing, and we are able to help them also.
Okay.
But if the patient has a heart attack, I immediately refer, or some such thing, chest pain, I would say go to the hospital. Okay, so when I find that my treatment is not helping, I immediately refer them to a physician or to the hospital, etc. So there's no problem with that. We work together. That's the simple thing. But in many cases, the treatment does work very, very fast. And we have referrals from allopathic doctors, from physicians also. So that is the thing. Yeah. I hope that answers your question, or do you have any other?
Yeah, it answered my question. Thank you very much.
Yeah.
My second question is to Dr. Kamlakar.
Yes, sir.
Sir, you are a urologist, and it is to do with something that I went through, and I need clarification. In April 2022, I underwent a surgery because I had a cancer on my right kidney and it had to be removed. So the nephrectomy was done.
Yeah.
Prior to my surgery, my creatinine level was 1.1. However, post-surgery, it went on to 1.9. And in the last almost 1.5 to 2 years, I have been advised by the doctor to restrict my diet to certain foods. No non-veg, no potassium. If there is medium potassium, leach and cook, reduce your oil, reduce all those things. So my question to you is it only by diet that my creatinine will come down, or is there any other way to bring it down?
Okay. Sir, are you a diabetic?
I am not a diabetic. I have no sugar. I have not had any other complaints.
Hypertension?
Nothing, sir. By God's grace.
See, creatinine 1.1 is perfectly normal.
Yes.
And now, many times people, they keep asking me what to do or how to bring down the creatinine level. See, creatinine level, it just reflects the kidney function. Whatever is happening in the kidney, that is reflected in the form of a creatinine.
Okay.
See, if the sugar levels are high, I can give medicine and bring down the sugar level. If a creatinine level is high, I cannot give any medicine to bring down the creatinine level, nor I can change my food habit to bring down the creatinine level. Creatinine level, it is just a reflection of what is happening inside the kidney. If by any reason the kidney gets affected by one or the other things, maybe an infection, maybe a diabetes or a hypertension, if the kidney gets affected, automatically creatinine goes up. Once you correct these factors, and if you avoid the effects of these things like blood pressure, etc., then no infection, automatically creatinine level comes down. Therefore, per se, to bring down the creatinine, there is no specific medication, etc., because creatinine directly represents your muscle mass. And so depending upon your muscle mass, the creatinine level is decided. For example, a small child, the creatinine may be only 0.2. A very well-built muscular man, his creatinine level itself may be around 1.8 or 2, because it reflects the muscle mass. Unless until the muscle mass comes down, the creatinine will come down. But in a normal individual, we cannot do anything to the creatinine, do something to the kidney only. Many times a patient with the diabetes, he comes, it is not controlled. The moment you control the diabetes, the kidney starts functioning better, creatinine comes down. The blood pressure may be high. The moment you control the blood pressure, the kidney starts working better, the creatinine comes down. If there is infection within the kidney gets affected. So then again, the creatinine level goes up. Once you treat the infection part, creatinine comes down. The kidney may be affected by a stone disease. You take out the stone, then again, the creatinine level will come down. Therefore, it is a myth. There is no drug, no medication, no food that can bring down the level of creatinine. Now, regarding the doctor, what he has told, proteins, etc. Yeah, particularly because now we have got only one kidney, we don't want a very more protein load should not be there for you. And whatever one kidney is there, see that it is flushed nicely so that there is no infection, nothing. Keep your blood pressure under control. Take a nutritious diet, do regular walking, etc. And don't worry about this. Even if the creatinine level, see if it changes from 1.5 to 1.9, etc. Suddenly we think, oh, my creatinine level has gone up. But in terms of kidney function, little change in the kidney, the creatinine will shoot up like anything. From 1, it may go to suddenly 2. So I get worried, oh, my creatinine level has completely gone up. So a little infection must have happened in the kidney, the creatinine level shoots up. Moment you treat the infection, the creatinine level, sometimes my patient, they come, sir, my creatinine was 3, now it is 1. So not necessarily that it is good, there is a marginal improvement in the kidney, therefore the creatinine level has come down. So please remember, creatinine is a reflection of what is happening inside the kidney with regards to its function. So give more attention towards the kidney rather than this molecule creatinine. Creatinine per se is harmless. I can eat creatinine. I can take creatinine by intravenous also. Nothing is going to happen to me. Understand? It is only an indication. Therefore, whenever creatinine levels are high, look at your kidneys. Am I keeping my kidneys healthier? Is there any infection? Am I well hydrated? All these, even if you are dehydration also, sometimes it may go up. So these are the factors you see. Concentrate more on or give attention to the kidney rather than this creatinine molecule. Creatinine, if it is more, it is not going to kill you at all. Don't worry about this. Because body has got a mechanism. In spite of, I have seen the patients with the creatinine 3, 4, 5, but still they are leading quite a normal life itself. So don't be obsessed with the creatinine all the times. I hope it has answered your question.
Thank you, sir, very much. Anyway, from 1.9, it has come to 1.5 in the last 1.5 years.
Perfect. Yes.
Okay.
That means you are taken care of your kidneys again.
Right, right. So would you call my condition a CKD?
No.
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 Okay.
No.
Thank you.
Thank you, sir.
Thank you
so
both,
much.
doctors.
I'll just add 2 points to what Dr. Achrekar mentioned. It's very critical for us to maintain hydration.
Yes.
Now we are entering summer season.
Yeah.
You do undue physical activity, all of a sudden you start walking around faster, running and jogging, etc. Your muscles undergo necrosis because of dehydrated status. And the creatinine is produced excessively, which kidneys are not able to tackle. Second important thing, remember please, all allopathic drugs are nephrotoxic. Without prescription, without the doctor's supervision, never take a single drug. Let it be even aspirin or anacin. They are potentially nephrotoxic. Third, in our day-to-day life, we consume so many food items which have got artificial softeners, coloring agents, and other preservatives. They are all known to be nephrotoxic. So, sir, if your creatinine is little more than normal, be careful about your hydration.
Yes,
Do
sir.
not take any over-the-counter medicines, right? And
Particularly
keep
painkillers.
the observation by the doctor. Don't be bogged down by 1.9 creatinine level at all. So
Thank you,
avoiding allopathic medicine at all cost. In spite of being an allopathic physician, I mean, despite being, I'm suggesting this. No painkillers.
Yes, doctor. I have to bear the pain if I get pain, but I cannot take a tablet. That is what I was told.
Yeah. See, if the
Thank
pain
you.
is really unbearable, taking one tablet, suddenly your creatinine will not go up. Understand? See, I have seen people, particularly with the joint pain, knee joint pain, they keep on taking a tablet known as a diclofenac sodium, which is a very powerful painkiller. And they go on eating like a peppermint, because it improves their pain. And one fine day, they end up with a kidney problem or what you said, a chronic kidney disease, CKD. I have seen many patients, we call it as analgesic nephropathy, means the kidney damage caused by the painkillers. And as Dr. Phadnis rightly said, all our medications, they go out of our body through the kidney only. And when they are passing through the kidney, they exert their side effects. They may affect the kidney. Therefore, another point which is very well mentioned by Dr. Phadnis is, if you hydrate well, if your flow of urine inside the kidney is faster, the drug will not remain in your kidney for a long time. It gets flushed out quickly, so that its effect is not there on your kidneys.
Thank you, sir.
Yeah.
You would say 2 liters a day?
Yeah.
Minimum 2 liters. You can go up to 4 liters also, no harm.
Thank you, sir.
Yes.
Thank you very much. ಧನ್ಯವಾದಗಳು.
ಧನ್ಯವಾದಗಳು.
Yes, as Distinguished Toastmaster Bhaskar said, Dhanyavadagalu, Dr. Achrekar, Dr. Prasad, and Dr. Phadnis. Let's quickly move ahead because I do see Mr. Raghavendra raising his hand, and I also see Smita has raised up her hand. We'll start up with Raghavendra. Go ahead, Raghavendra. Can we
First
have
of
you on
all,
camera?
Sure.
Yes.
So first of all, thank you for the opportunity. So my question is to all the three panelists here, and it's in some way tied to the first question, so to speak. So I was diagnosed with COVID and had to get admitted to hospital and so on. And during that time, my HbA1c was around 6.4. I got it tested last year and a few months ago again, and it is now at 5.1. Right, I was grossly overweight. To be honest, I was above 3 digits. But at this point in time, I have hit 87. And I'll just briefly tell you what I'm doing, and where I want some inputs is whether I'm doing things right and whether this is sustainable, right? I have cut down in terms of sugar, rice, and wheat. I have 2 meals a day. I have vegetables and I have egg, right, almost on a daily basis. I don't have breakfast. I have lunch and dinner. I go for a brisk walk in the morning for around 45 minutes. What is happening is this, right? So I don't have any dosa and all of that to a large extent possible. But whenever I go to my hometown and I have breakfast or whatever sort, what happens is my head starts reeling, right? I've stopped even having coffee or tea. So no milk either, no sugar, all of that is closed. But the moment I have something which is, even let's say one bit, right, in the mornings, my head starts reeling and I feel extremely lethargic. No such feeling if there's no breakfast that is there and all of that. So carbs are totally cut. I think so. Broad questions is this something that is sustainable? What I'm doing, is this right? No fruits also, right? While physically I'm feeling well, good. The only problem is, sometimes if there is a 3 meal a day, the moment the first meal is done, which is let's say breakfast, right, it's extremely heavy, extremely lethargic, and I feel very sleepy.
Can I take this question? See, well, in fact, if you really want, we can have one full solid session itself regarding the myths of the so-called weight reduction. A lot of misconceptions are there. I will try to quickly say many points. See, people say morning you take a limbu water, your weight will come down. Absolutely foolish. You stand on that shaking machine there, your weight will come down. Absolutely foolish. You wear a belt from where your fat will come in the form of a sweat. Totally foolish. People, we just go by that without even thinking, without applying our scientific mind. See, it is simply, what happens. It is a question of calories. I tell you a very simple thing. Either you are taking more calories or you are burning less calories. See, the calories are the source of energy, and that comes easily, number one, by the carbohydrates, and next is the fats. And I can speak at a length of time regarding intermittent fasting, which Rajeshwari Madam, she wanted to really know about it. In fact, I fully endorse doing intermittent fasting is the only way to reduce your weight, along with exercise and your proper nutrition. I call it as a conscious eating. See, in the entire animal kingdom, if you see, human beings are the only one who eat without being even hungry, who eat in between whenever they want. In good old times, when the man used to live in the caves, he will just go and he will hunt and he will eat. In between, he will not eat. If there is no, if he doesn't get anything, he will go fasting on that day. He was keeping a good health. Now, wherever we go, we find any opportunity. We never ask whether I am hungry or not. We keep on eating. We keep on eating. So we accumulate a lot of carbohydrates. But how much we burn? I'll tell you a simple example. If we eat one gulab jamun, it takes hardly 30 seconds for you. But to burn the calories of gulab jamun, you have to walk next day for 5 kilometers. It takes around 45 minutes. The choice is yours. You decide whether you want to eat one gulab jamun and then go for a 45 minutes walk. Better you stop, don't eat gulab jamun at all. Therefore, it is mostly the high calories. I suggest what is called as the conscious eating. In your diet, you must have that conscious eating. Whether my diet contains sufficient proteins, the protein content requirement at least 1 to 2 grams per kg body weight. Most important, the fiber content, which is largely neglected. At least 30 grams of fiber is required for us. So that fiber will keep you full, it will not give you that hunger, and you can go on with that. And intermittent fasting, particularly 16 hours of fasting, will definitely make a magic. What happens in 16 hours fasting? I'll tell you very quickly. Now, you are taken food within 4 to 6 hours. Now insulin is produced. Insulin will immediately send your food. It converts into glucose, and that is going for energy. Extra glucose goes and stays in the liver. And then the fat is there and the protein. Proteins are not touched because they are very important. They are used only for the building the body. The carbohydrates or the sugar, they are easy source of energy, and next is the fat. Now, when you are doing 16 hours fasting, within 4 to 5 hours, your resources of carbohydrates like the glucose, glycogen, etc., they are completely exhausted. Now your body has to depend on the energy for the fat only. And at that time, your fat is mobilized, and then only your weight starts coming down. So it is called as fat adaptation. That means your body depends on the fat for the energy. At that time only your body weight will come down. Therefore, reduce the fat, as I said, reduce the carbohydrates, sufficient proteins, sufficient fiber, and exercise. These things will certainly help you. 16 hours fasting, if you strictly do it, I can bet and tell you your weight will come down. So initially what happens, you may feel hunger. See, because after about 4 to 6 hours, what happens, that hunger hormone is produced. It is called as a ghrelin. And I start feeling hungry. And this hunger will not last for longer. It will stay maximum for 1 hour. If you can control at that time, the hunger will go. Slowly you start learning. There are fasting communities who fast. Even Ekadasi in our Hinduism is a fantastic concept. Understand? There are people who do fasting for 24 hours, 48 hours. At least minimum 16 hours fasting you do religiously, scientifically, I am sure your weight will come down. If anything more, I can speak to you separately because now time will not permit me to say much more in detail again. Thank you so much.
Sure. I think that was fairly comprehensive, but if Dr. Prasad or Dr. Phadnis want to add anything more, I'd be happy to hear.
Dr. Phadnis, do you really have to go at 8 o'clock? Can you continue for some time?
It's hardly 10 minutes.
Another 10 minutes.
Okay,
Yeah.
give priority to Phadnis only.
Yes.
Yes, yes, sir. On this question, do you have any particular comment?
Dr. Phadnis,
Yeah.
do you have anything further to add on that question?
Yeah. In fact, I got a feeling that I am attending a lecture by a diabetologist. He has covered practically everything. But let us concentrate on one particular thing. Somebody mentioned about glycosylated hemoglobin A1C being about 7.5 or 8 or something like that. Only way you can bring down that A1C is by controlling the sugar. And it is a sustained reduction of sugar, which over a period of 3 to 6 weeks or 3 months is going to bring down glycosylated hemoglobin level down. It should be ideally 6.5 or 6.6 only. It should not cross 7. If it has crossed 7, that means your diabetes is not under control. If you have got a A1C done today, it does not mean that today it is out of control. Over last 3 months, it has been out of control. But when you do a blood sugar, it is on that particular day, your fasting sugar is normal or abnormal. So A1C is a guideline regarding overall control of your diabetes in previous 3 months. And the side effects of diabetes that our body suffers from are the result of sustained increased carbohydrate level or sugar level. The second important concept, that is a misconception rather, people always get a feeling that diabetes means abnormal sugar. But abnormal sugar is just one part of diabetes. Abnormal fat level and abnormal protein level is also an abnormality concern seen in patients with diabetes. That's why it is called as a global dysmetabolism. It's an abnormality of metabolism of all protein, fats, and carbohydrates. So when we take care of a diet in management of diabetes, it is not only focusing on carbohydrates, but it's also important to focus on fats and proteins. Ultimately, for maintaining your body mass or body energy level or muscle mass, you require adequate protein supplements. You can't deprive yourself of protein supplements also. But the kind of protein that we consume is also important. So it's a global dysmetabolism, not only sugar, but protein, fat, and carbohydrate all need to be looked into. And our target should be glycosylated hemoglobin less than 7, let us say practical level, and ideal weight for that particular height and that particular gender. That's the only thing I wanted to add.
Yeah, just one follow-up question. So for someone who's following a diet, etc., what is the interval that you would suggest for A1C checking? I mean, you just mentioned it's a 3-month average. So is once a year fair enough, you think, Dr. Phadnis?
No, I didn't get your question properly.
No, so as I said, right? Yeah, how frequently should a person who's undergoing a diet check his HbA1c levels?
I'm still not able. You're not audible clearly.
How frequently the HbA1c should be repeated?
After 3 months. If you go to
every 3 months,
you will find that they start doing
months.
A1C level every visit. It is not justifiable at all.
Correct.
At the most, every 3 months. Not
I would like to just add one thing to Mr. Raghavendra. See, many people after COVID, they get very anxious and worried. Okay. So don't be in a panic state or something. Take it as a long-term thing. So don't be in a hurry to, I don't eat this, I'm not eating that, I'm not eating this. I'm not saying you go into some, what do you call it? Don't eat everything and go into fat diet. But on the other hand, don't also starve yourself or something like that. It's not good. Okay.
Right.
Have a reasonable diet and take it as a long-term thing. And don't get anxious so much. Okay.
Right.
Things will settle down over a period of time.
All right.
Yeah, Veera.
Thank you folks for the opportunity. Thanks.
Thank you.
Even if you fast for 24 hours, your sugar may not come under control. So fasting is not the solution.
Yes, got it. Thank you. Thank you, doctors. And there was a question from one of our audience members, Smita. So with our growing technology, right, whatever is happening is whenever there's a small health difference, we immediately go to Google if there's a headache or diabetes, right? And it is obviously going to lead to a misinterpretation and affects mental health and everything. So personally, Smita has visited the doctor for diabetes before planning pregnancy. And the answers in terms of the diet and the tablets that she had to take, it was literally scary. So in such cases, what shall be done ideally? What is the solution on this?
To whom this question? I strongly discourage people going through the Google in only one word, that's all. Simple. Understand?
Yeah.
Totally don't go for it because you do not know what all the information Google gives and it will be more confusion for you. Go to the concerned specialist, have a discussion. They are there to help you, not the Google.
I think the one-line takeaway would be,
certainly.
doctors are here to help us. So it's better to go to the concerned physician rather than...
I sort of disagree with Dr. Achrekar here respectfully. See, my thought is you have certain very good resources. So for you have the Mayo Health Clinic. Okay. Like that, there are a couple of sites. I feel that patients need to educate themselves and then ask doctors also. So they can come with questions. Don't just read something and then do what you want, but you can come educated and ask certain things. These days, especially, all of us are very, very busy and we are in a kind of a hurry. Sometimes you might know what to ask better. You can take informed decisions. You might want to take a second opinion based on certain things. No harm, in my opinion, in yeah.
Okay.
Yes, sir.
I'll tell you now. See, now, for example, if I look into the Google and an ordinary person looks into the Google, what is his background? See, if I look at the TV, it is a sound box which gives you entertainment, but an engineer will look at it in a different way. Therefore, the same Google information, it can be perceived in a different way depending upon my basic knowledge. And most of the time, I tend to get confused. But a doctor can try to tell you, he can give you a ready-made, digestible answers as per your understanding capacity. You can ask even further questions and get them clarified. And so why unnecessarily, I really don't understand why an ordinary person for medical problems, he has to go and consult a Google and start taking treatment also. See, if you say, for example, the testicular pain, there are so many things are written, right? From the testicular cancer to everything. And patient, they come and eat my head. Sir, I've got a testicular cancer now. It becomes difficult for me to convince him because that has gone in his head through the Google itself.
And it's a human tendency when you get an explosive information on Google, people tend to internalize the side effects or the downside of the medicine that is being that knowledge. And he comes with questions asking the doubt regarding the integrity of the doctor also sometimes. If you have any doubt, ask the doctor whom you are consulting. Are there any side? Because patients will always think about the side effects, doctor will think about the effect. As I mentioned earlier, there is no medicine which is absolutely safe. It is bound to create some side effect, but we consider all aspects of that particular case before prescribing medicine. Take common example for aspirin now. Earlier used to be taken left, right, center for headaches, for example, Aspro, Anasinol. Now we are using it as a lifestyle procedure, to preventing clot formation, prevention of angina or prevention of stroke. Doctor, why are you giving me aspirin? I don't have any headache. If such silly questions come to you, your wit's end. Is our tendency to internalize all those side effects which are explained on the Google. The judicious use of Google is advisable.
Sir, it is. I am not talking about Google. I'm talking about, of course, if we give the specific websites, which are, see, Google can give all kinds of nonsense also, but reliable websites. And I can tell you this, that very often a patient with rheumatoid arthritis or fibromyalgia or autism, they often know more than us because they have lived with the condition over a period of time. They come and I learn things from my patients very often. And well-educated patient will not ask so many silly questions. But I would definitely say, especially in the current day, when the doctors are also in a hurry, many things are missed. Many things are missed. They don't answer all questions. And it is very important to, I would definitely say, get to know about for example, the side effects of certain drugs. Do the doctors tell you that I'm prescribing this? These are all the side effects that can happen. They will not. But if you can read up for yourself what medicines are there and you have a side effect, you know it. You know that
you
this
won't even take it also when you know those side effects.
I'm sorry?
When you know those side effects, you will not take it also then.
No. Then you
because there are so many. See, one has to see the pros and cons. You see, there are dozens of side effects are there. If you look at, as Phadnis said, if you internalize all those side effects.
Just one simple example I'll give you. Many patients who take corticosteroids inhaled, okay, they are not told by the doctors often to rinse their mouth after it, which causes fungal infections, which can cause a fungal infection. This is something which, is it a harm for a patient to know that you need to rinse your mouth after you take an inhaler, a steroid inhaler, if you're taking it regularly? You read it and you say, you ask the doctor, should I rinse? They say, of course you should rinse, but I haven't told you. You see, I've forgotten to tell you, I'm writing so many things, I'm examining you, I'm taking a history. So many things happen. And there are so many such things. I can give you, I mean, like, So patients tell things which we find useful to tell the next patient also. Like I had one patient with a breast cancer, a male, and he told me about a new test that that's used for screening. I had never even heard of it. I looked it up on the internet.
Mammography?
Not a mammography. Mammography is an old, ancient, what do you say? My grandfather would have used. No, it is something else. I can just ping him and tell you. But it's something very interesting. It's a new technology that's come, and he's used it. It's not yet available in India. But these are the kind of things which are, what do you call it? Because he's a well-to-do person, he's gone abroad, done it. I'll pass on that information in the Kannada bilingual guest group, because these are important things. We learn from our patients. Every day we learn.
No, very true, Prasad. But I do not know. At least most of our allopathy doctors, we regularly go to our conferences. We never miss our conferences.
CME,
Where
continuous
the
medical
newer
education,
things are discussed. We have to be abreast with the newer knowledge. We should not learn from the patient. We must be abreast with that. We must know before even patient comes to know. If I do not know and patient tells me, it is my fault. I must see that my knowledge is
for example,
updated every time.
For example, there is a perennial entrapment syndrome. Okay. A patient came with it and he was talking about a certain therapy using a wand. This is from the UK. Okay. Now, how can you cannot know about perennial entrapment syndrome and then, all kinds of, let's say some, some sinusoid somewhere or some, it's not possible. Cerebral palsy, if I ask you, what will you say? No, but when the patient comes and tells you, we have been living with it and we have consulted 14 people, gone to all these specialists, I've gone to so-and-so, they told me this. We read it, we get a good education. And then if we study up further, so it really, I do believe that patients these days have to take a certain amount of personal responsibility for their conditions, because you go to the hospital, you are not anybody who's gone to doctors can tell probably how much is explained, how detailed the explanation is given. It is not so this thing. I mean, people can speak.
But yes, I think,
we are,
sorry to
let
have
us stop this
interrupted.
discussion. We'll take up some other questions.
Sorry to interrupt, but I think that was a respectful disagreement, and we got to hear both the perspectives. Thank you so much for putting the thoughts forward. But yes, at the end of the day, our health is in our control, and we'll have to take the responsibility for that. So, as I would want to just re-emphasize it again, despite all the resources and everything, we get our information. At the end of the day, someone who has studied and experienced as a physician, you all as Dr. Prasad, Dr. Achrekar, and Dr. Phadnis, you will be able to add more comments on it. And I think Dr. Phadnis will have to
sign out.
Can you please? Yes.
Veera, Dr. Phadnis has just requested that he needs to sign out.
Yes.
Okay, great.
Thank you so much, Dr. Phadnis, for your time.
Thank you for joining us.
Thank you very much. It was a pleasure to interact with you.
Thank you.
It was a learning experience for me also.
Thank you, sir. Thank you for sharing your valuable insights. All right.
I just would like to, Veera, just 1 second. See, there is a doctor in Apollo Hospital here. Okay. I had asked about a sensor which is used, a continuous monitoring sensor. She goes for CME, etc. All of Apollo doctors do it. Okay. When it was first released, Freestyle Libre, it is called, for diabetes, continuous glucose monitoring, a patient had mentioned it. I spoke to her and asked about it. She said, I'm not aware. Okay. It had come to India and this patient had bought it and was using it. So I came to know through the patient. I looked up, I asked the doctor, she said, I didn't know. Then I checked with this one. It is some pharmaceutical, some company. I forgot the name. They said, yes, it is available today in India. It's a inexpensive continuous glucose monitoring. You wear it, it's for 14 days. You can just pass that thing. You don't need to prick yourself anymore. Just pass the thing. You can see the reading, how much the sugar is. So learn from patient. Okay. So anyways, yeah.
Thank you, sir. Thank you, Dr. Prasad, for adding more info. I would want to take a moment to read one of the questions that we have gotten from the online form that the audience have submitted. So there is one person who asks, there is bacterial infections that we have heard of a lot. So they just want to get a one-liner about what is a bacterial infection, how do we stay away from it, what can we do to not contract an infection from a bacteria. So any of y'all would want to answer that, please?
Dr. Achrekar.
Yeah,
Yes.
can you just repeat? Bacterial infection, is it?
It's just they just want to get enlightened about bacterial infection.
What is a
how it
bacterial
caused.
infection?
That's all. Simple as what is a
It is a
bacteria.
very vague question. Bacterial infection. See, bacteria they are the small microorganisms which can cause infection within the body. So it can cause anywhere. It can cause a sinusitis, it can cause a pneumonia, it can cause a kidney infection, it can cause a bone infection, it can cause urinary infection. Any part of the body. See, if you do not want to have a bacterial infection at all, then keep your general health, keep your immunity levels higher, take a good amount of proteins, maintain a good health, do regular exercise, and have adequate sleep, avoid stress. If you do all these things, your immunity will be high, and obviously no bacteria will come nearer to you.
Yes, got it, sir. Thank you. I think it is about maintaining the health in a way that our immunity is pumped up. Sorry, sir, you were about to say something.
Same. It is, if you maintain a good health, forget about your bacteria, even cancer, nothing will come to you.
Yes. Absolutely. Thank you. There is another interesting question. So if someone cannot quit smoking, what can they do to reduce its negative effects on the body? What they indirectly mean to say is, I think they want to continue smoking, but not to have its negative effects.
Prasad, you want to answer?
Sure. See, one thing is, as doctors, there is a study on this. By constantly telling patients not to smoke, over a period of time, not a large percent, but about 5% of the total numbers do quit. So it is our duty as doctors to always tell patients to quit. I in fact tell them you can help yourself more than I can help you by quitting smoking. So when they ask you about such questions, first is to educate them, yes, and tell them that it's not only about cancer. Smoking affects every tissue in the body. It affects the blood vessels itself. The very blood vessels are narrowed down, so it affects the heart. It affects the legs. You may need an amputation of the leg. Can cause emphysema, chronic obstructive lung. So many conditions. And I also tell them that it will affect your family. There is residue on your clothes. You carry your child, your wife. They will get problems too. It is not just you. So you have to quit smoking. Yeah.
Okay.
See, and having antioxidants and saying that they will protect me from, it's not a good idea.
See, I don't think so. On one side, you consume a poison, and at the same time, you say how I can avoid the side effect of the poison. Generally, the tactics what I follow is I create what is called as an emotional impact. See, for example, I'll say how many children you have got. So I got a child about 8 years old. Are you interested for your child's welfare? Do you want to see him getting good educated, good family, getting married, etc.? But if you continue to smoke like this, I'm afraid you may not be able to do this. At least in the interest of your child, you give it up. In the interest of your family, you give it up because you've got a lot of responsibility. And keeping the responsibility, if you pass away in between, what will happen to your family? So create an emotional impact, because for anything, once an emotion is brought, it is very easy. And so I tell them, before you light a cigar, look at your child first. Look at his future. With the cigar, you can still bring the future of your child. You go ahead and smoke. So you must learn how to create some kind of an emotional impact to see that they give up smoking. There is no shortcut. They have to give up smoking. They cannot smoke on one side, and on the other side, they cannot have a barrier to prevent its side effects.
Totally. Yes. Thank you so much for sharing more light on this.
I just have one point here. I'm not sure if the person who asked the question is in this meeting, but I think the question was broadly around a couple of other aspects. Whether there are a lot of alternatives today, like a nicotine patch, and then tobacco companies have alternatives today, like what they call as vapes and electric cigarettes, etc. I think the question was more on that side, saying, I don't smoke a normal cigarette, but if I switch to this, is the impact lower, etc. As someone who is on the analytics side from a professional standpoint, I see that there are a lot of consumers globally are going in for these kind of products.
It's Raghavendra, right?
Yes.
Yes, see, the question was not that. He says, if I continue to smoke, what things can I take which will reduce the side effects? Wasn't that the question, Veera?
Yeah, it was basically, if someone can't quit smoking, what can we do to reduce the negative effects on the body?
To reduce the negative effects. So I will continue to smoke. What can I do to reduce the negative effects? Not what are the alternatives to smoking. That's not what they're asking.
Okay.
Yes. Yeah. But yes, I think it is imperative that one takes their health as the highest priority and be very mindful of what goes inside our body, right? Because that is going to ultimately affect how the way of living. I think on a lighter note,
recently one patient told, I'm living in a city, so I'm already a smoker. You see, he's living in Noida or Delhi. So now the situation is you're in Noida and you're still smoking. That's like, you might as well take a gun and shoot yourself.
The worst thing. I think I just remembered on a lighter note. Again, of course, we all know the infamous Mukesh, whom we see during the movies whenever the intros come in. But yes, it is something for us to remember and make sure that we know what we are doing. We are conscious of what we are putting in our body. So let's always keep that in mind. Thank you. Yes, there was another question online in the form. I think in the interest of time, we'll just take this one question and one last question from the audience. Yeah. Okay. So this question is, what can I do to control BP without taking any tablets?
Control?
BP, blood pressure.
BP. Without taking tablets.
Blood pressure. Okay. Can I?
Yes,
sir, yes. Though I'm not a physician, I can tell you. See, first of all, it depends upon what is your level of blood pressure. Do you have a very high blood pressure or a moderate blood pressure or a low blood pressure? What exactly? First, try to find out. Listen, see, again, before you embark on anything, you consult your physician where you stand. Listen, because somebody suggests, you do meditation, your blood pressure will come down. Yes, I do agree. But it is not a rule of thumb to each and everyone. It is an added influence. You see, it can help you. Meditation is not the treatment for hypertension. Meditation will help you to bring down the blood pressure. If you've got a very high blood pressure, probably you may require the help of a physician to bring down your blood pressure. Later on, physician will also tell you in your diet, avoid excess of salt, then avoid your stress. See, it is very easy to say, go on telling avoid stress. I don't know. It is not that easy. Because stress is a part of our life nowadays. But that's why I keep telling do not be stress prone, but stress tolerant. You must change your personality like this. There are many people who are called as stress prone individuals. There are people who are called as stress tolerant individuals. My whole aim is to convert the stress prone person into a stress tolerant, so that he starts making the positive benefits of the stress. Understand? The stress is not really bad, but one should know how to encash that particular stress also. Well, do meditation, again, exercise, less salt, understand? So these things will definitely help you to bring down your blood pressure. But these are not the main thing. If at all, in spite of these things, still your blood pressure is higher on the higher side, you require medication. And keep on regularly monitoring the blood pressure, probably by following these ancillary methods. Slowly your requirement or the dosage of medicine may come down. Not necessarily you may eliminate completely. It may come down. But don't have this aversion. Sometimes I keep seeing patients, Doctor, they tell with the pride. I tell them, why? I say it is an egoistic answer. If required, you take. Now, come what may, they may be having high blood pressure, they may be having giddiness. Because I have decided. It is an ego. Don't boost your ego at the cost of your health. Okay, I hope I have answered this.
Yes. Understood, sir. Yeah, thank you. Thank you so much for adding in. I think...
Hey, Veera, can I just say one thing? What yes, Dr. Achrekar said is perfect. The degree of high blood pressure, what can happen? Blood vessel can burst in the brain.
Correct.
you can have a stroke immediately. So at a certain level, let's say it is 170 by 110, etc. You're asking for trouble, danger. Okay. The second thing is, even forget about Talasuttu, nothing is happening. It is called a silent killer. Okay. Your BP may be very high, you may have no symptoms at all. You may feel perfectly fine. But blood pressure is the pressure of the blood at which it is kind of like irrigating the organs. So you can imagine using a high pressure water hose on flowers. What will happen? The flowers will get destroyed. So our delicate tissues like the eye and the kidney, these are the most delicate tissues. They are damaged whether you know or don't know. When the BP is consistently high, they are getting damaged. So you have to take the medication, or if you say I'm not taking the medication, doesn't matter. You see that your BP is under control. If you can show that by meditation or by mantras, my BP is totally normal, do your mantras. But your readings must be in a good range. It should be 120 or 120 by 80, approximately plus minus 5. It has to be there, whether you do it through mantras or whatever methods. Usually medication works. Madhura wanted to ask a question.
Yes, one last question.
Yes, yes. Last question from Madhura. Yeah, go ahead, Madhura.
Yeah, so being vegetarians, how can we improve vitamin B12? And one more thing, also, Phadnis sir already mentioned 90% of us are already vitamin D deficient.
D3, yeah, D3.
Yeah, and most of us being IT professionals, we work from morning to evening in AC. So we can't go to sun always. So is there any food that we can improve vitamin D as well?
Okay, Prasad, you tell me. Later on, I will add something.
Okay. See, first thing is many people have skimmed milk, thinking that it is a much better this thing. But whole milk, vitamin D is a fat-soluble vitamin. Okay, it comes in fats. So oil is the main source of vitamin D. Now, one simple solution, Madhura, if you're a vegetarian, vegan, whatever it is, you can still take a vitamin D supplement, vitamin B12 supplement. Okay, nothing wrong in it. Whether it is synthesized or you get it through your food, get it is the important thing. So on a regular basis, if you can take a tablet of a vitamin B12 once in a while, okay, it depends on the dosage. You get a whole range. Okay, you can get 1,000 micrograms or you can get a 20,000 micrograms, whatever it is. And vitamin D also. So supplementation plus foods, you have your oils also in your food, you have your whole milk. And for vitamin B12 and all these things about whole rice, you know, the not polished rice, the brown rice, all these things give niacin and other vitamins and all these legumes. You can easily look up. If you just look up on the internet, vegetarian foods with good B12, you have a whole list. Okay, so that is it. See, just look up and have supplements. What's wrong with taking a tablet if you're, what's wrong?
Correct. See, say, Madhura, you need not become a non-vegetarian to improve your vitamin B12 levels. You can continue your vegetarian diet. Even vegetarians will also get everything. If you take all the pulses, vegetables, fruits, everything, you get, of course, vitamin B12, etc. You do not require in a large quantity. They're all vitamins, means they are required in a very small quantity. That's all. You don't require a big chunk of that. And that you can easily get it if you again have what's called a conscious eating. You know, if you look into what you are eating, particularly your junk food, you know, I am very specific about this. Most of these junk food, they do not contain any nutrients. They contain a lot of fat, lot of sugar, lot of oil. So they do not have any nutritional value. They have got a high calorie value. If you can avoid the junk food, concentrate more on the fresh vegetables, fruits, etc., you get required quantity of vitamin B12 and vitamin D3 also. And as Prasad said, if needed, you can take the supplements. There is no harm. And many times I keep telling patients, you know, whenever they come to me, even diabetes, etc., I see, you always expect a medicine to me. No. Exercise is a medicine. Understand? Going in the sunlight is a medicine. Fasting is a medicine. Don't think medicine means always a pill or the injection only. Not necessary. We want for anything a ready-made pill. I do not walk I cannot expose myself to sun, give me a pill. No, you cannot compromise. In spite, if you are really worried more about your health, you will automatically find some time to walk in the fresh air, expose yourself in the sunlight also. That is also a medicine.
Thank you. Yeah, actually, like Prasad told, I have Googled and I have got most of the suggestions to take fortified drinks and cereals. Are they good to take?
Cereals, huh?
Cereals
Fortified
and
grains
also
and cereals.
drinks with vitamin B12, vitamin D.
They are processed foods. See, these fortified, like, all these Kellogg's cornflakes with fortified vitamin D and all that. You can take it, but it's what you get in in your pulses. You eat rajma, you eat chole, you eat ragi. You will get it. You want to pay 2 times and bite in. Instead
I
of
am not in
eating.
fear of a Kellogg, your Maggie,
Absolutely, absolutely.
Coca-Cola, etc. I strongly discourage.
Yes, yes. They also put all those, preservatives and all those things come. If you buy chapatis which can be heated and eaten, they can be kept for 15 days because there is so much extra salt, extra preservatives. Those things will affect. Those things will affect you. If you have, instead, as I said, you look at the charts. It will tell you mushrooms are good in vitamin D. Okay.
Yes.
It will say whole milk is good in vitamin D. So you can look up and easily choose your foods. Choose your foods.
Yes.
Okay? Yeah. And as Dr. Achrekar said, if you really care, you will find the time. There is no question about it.
See,
Yes,
one last word I want to tell. I always keep telling my patients, to earn money, to earn status, something, we go heaven to earth, put lot of efforts, do everything, understand, for the sake of earning money or the any status, etc. I tell you, your health also needs to be earned. You have to earn your health. You have to put in the same amount of efforts what you are putting to earn your revenue. You must also earn your health. Unless until you have this attitude of earning my health every day, you see whether have I earned my health today? Did I walk today? Did I took fruits today? Have I taken vegetables? Have I taken enough fiber diet? Look into that. So that's how you keep on earning. Add points. Yes, today I have done something for my health. Today I have done something for my health. I did a good exercise. I went in the sunlight. So I earned some points there. So that's how, please remember to earn your health. Health will not, it's not for sale. You just can't get it in a shop, etc. You need to put in a lot of efforts. Then only you will be healthier.
Yes, totally. Got it, sir. Thank you so much.
Really, I'm so glad I attended this meeting. If this was a paid seminar, I would have said paisa vasool. Just for this beautiful idea, actually. It has to be earned every day. I'm so thankful to you, Dr. Achrekar, for this thought. This is a wonderful thought, actually. Thank you.
Thank you. I think it just comes back to this one simple line. That is, Dr. Phadnis was also mentioning, right? Just cut down your fast food, baked food, altered food, preserved food, tinned food, and focus more on what is locally available, what is naturally available. Be very mindful of what you're eating, your health consciousness, and also making sure that you are working out, your exercise is part of your routine, your body is moving, you have enough sunlight. Make sure you have all these points in check. And I think that'll make your visits to the doctors lesser in the year. And I'm sure the doctors want that too. They want us to be healthy and be safe. So as Dr. Prasad was mentioning, I feel extremely thankful for getting the opportunity to host you all in the panel, and also to have listened to all these wonderful words and the wise words. And I think it is a reminder to all of us that we make sure that our health is in our control, which we put our every single effort into it and earn it. So thank you so much. I would like to thank every single audience member who have joined in, asked your questions, and I'm heartily thank all three doctors who have come in and spent your valuable time in sharing your inputs and shedding light onto the questions that our audience members and the members of KEBT had. I once again thank you all, and thank you so much for the opportunity. I would like to now hand it over back to Dr. Prasad, the president of Kannada English Bilingual Toastmasters Club, to take the proceedings forward.
First of all, Veera, thank you so much for being the MC for this event. And it's a start. Somebody was just messaging me and saying that we should have another session by the same doctors. They said, we'll think about it. But we have some...
So one suggestion.
Yes, sir.
See, if you keep a general session on health, it is a very vast subject. You just cannot cover it within 1 hour. Try to pin down to specific. For example, take only on the weight reduction. Let there be discussion completely on that. Or talk something only about the diabetes. Let there be complete discussion on diabetes, something like that. So one specific thing, if you take, or something about some urinary problems. What are all the different kinds of urinary problems? Or let us say there is a stone disease, a kidney stone is there. There are a lot of myths about the stone disease. So if we can keep one specific topic and the person, they will ask the question pertaining to that topic, then you can have a meaningful discussion. Here in general, entire health is a very vast subject that cannot be covered. Obviously, we are running out of time, and many of the speakers, they have to cut short because there is no time for them to explain many things. So try to have some limited topic, something like that, where you can concentrate on that particular topic itself.
Good idea. Good idea. We'll definitely consider it. But I'm glad that there were so many people who attended this meeting. It is just a first start. See, sir, one of the things is tomorrow we might have a session on policing, on Ask the Police. So if we try to keep it to a limited thing about the police, what if your house is robbed, or what if somebody is doing something on the road? That becomes a little limiting. If we say kidney stones, many people might not have attended today if it was only kidney stones, But anyway, we will.
No, there are many people pertaining to that topic.
But not in this group. I don't know.
Yeah, probably.
Yeah. The kidney stone fellow will come and attend this meeting. Not the fellow who's trying to lose weight. You understand? So that kind of a thing, we have to balance it out somewhere. I think what is required is more time. We need time, and we need people to join. I think it slowly, if it becomes popular. Today we started about 7:15 or 7:20 because people were not there. But as it becomes popular, it will be this thing. Wonderful. Thank you all for joining in, for sending the questions. In the beginning of the meeting, I was telling Dr. Achrekar and Dr. Phadnis and the MC that it might be just the four of us. Let's ask each other questions. But many people joined, many people asked questions. Hope we were able to answer them satisfactorily. Going forward, we will have many other interesting topics like asking legal questions. We have a panel of legal people. And just now somebody has said that I am an investment advisor. I can talk about that. We will definitely have multiple sessions. And again, I must say, your last comment that everyday health must be earned. This is where we need to, is a point worth closing on. It's fantastic. Fantastic thought for the year. We have just started the year. Okay. Keep this in mind. Every day, earn your health. And let's see you at our club meetings. We meet every week we meet. So the first and third Saturday of every month, and the second and fourth Friday of every month. If you're not part of our bilingual Toastmasters guest group, I can add you. You just have to ping me. Many of you know me. So, or whoever you know in KEBT, please ping us. We will make you part of the group. If you like such panel discussions, that's all. There will be many more of those. Many other things. You can join us. We'd love to see you again. Good night. It is 8:30. We started at 7 o'clock. We close at 8:31. Okay, on time. 1 minute over. All right. See you then. Bye.
Thank you. Thanks, everyone.
Thank
Have
you.
a great night.
Good night.
Thank you. Thanks, everyone.
ಧನ್ಯವಾದಗಳು.
ಧನ್ಯವಾದಗಳು.
ಧನ್ಯವಾದಗಳು.